Good afternoon, it's Adam Brown here, the Chief Executive Officer of Newbery Healthcare Group. To my right here at an appropriate social distance is Dr. Sarah Newbery, our Chief of Staff, and we've got a message for the population today to talk about COVID-19. What we want to talk about is, this is now a different world and we want people to treat it seriously. We have implemented our pandemic plan at Newbery Healthcare Group at our hospitals in Marathon and Terrace Bay, as have almost all hospitals in the country of Canada. We are actively testing in our community for COVID-19 and are operating under the assumption that there is already COVID-19 in our communities. Our hospitals are now closed to visitors, and that's a very large inconvenience to our patients and our families, but we're trying to protect our vulnerable populations and break the spread of chain of COVID-19. We can't do this on our own. We need your help.
Yeah, so thanks Adam. I'm Sarah Newbery. I'm one of the family physicians here in Marathon and Chief of Staff of North Superior Healthcare Group. And I really appreciate the opportunity to send a message to our community today about how seriously we are taking this as a clinical group. My ask of you this weekend, some people in our community will be returning from spring break. We know university students are also returning home, and welcome back to all of you. We know this isn't an easy time. But my ask of you, if you're returning from travel abroad, is that you take the guidance to isolate yourself very seriously. This is no longer a recommendation. We are insisting that you isolate yourself in the hope that that will contribute to buying us some time to manage COVID-19. Everyone in this facility, everyone at the clinic, really, people are working so hard, and I should take a moment to say thank you to all of them. Everyone from reception staff to nurses to physicians to dietary and housekeeping and maintenance. Everyone is working very hard to get ahead of a situation that we are very concerned about. Your part in this is to stay home if you're returning from abroad, to stay home if you have symptoms, even if you haven't traveled. If you have a cough or a runny nose or a sense that you're getting a cold, stay home. It doesn't matter where you work. If it's the clinic, if it's Canadian Tire, if it's a barrack, if you have symptoms, stay home. We are asking you to support us in our effort to buy some time on this. Isolating yourself is not easy. We are working hard to create tools to support you to do that. And if you look at the Marathon Family Health Team Health Promotion page, and we'll share this video from that page as well, you will find tools to support you in isolating yourself at home, because it isn't easy. We know it isn't easy, and we want to support you to be able to do that. If you are at home, if you do develop symptoms, if you're wondering if you should come in and be swabbed, please go to the Ministry of Health self-assessment tool. It is at covid19.ontario.ca. We'll share that site as well. You can go through the self-assessment tool. If you are directed by that tool to be swabbed, please call ahead. Call the clinic on Monday, call Emerge through the weekend. Speak with a healthcare provider, and we will direct you appropriately in that instance. I want people in our communities to understand that we are all, as healthcare providers and teammates in administration, we are all at work. We have been for many days here working for you, and we are asking you to stay home for us. Adam, I'll turn it back to you.
Yeah, and just a final message. Thank you, Sarah. Again, we are all here working many, many hours, all of our staff and our healthcare associates in all of our communities, taking this very, very seriously. And I really implore all of you, take this very, very seriously.